Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and host for the Dean's Chat podcast. Over the last several months, we've been doing bonus episodes, and we've been talking to students from the various schools and colleges of podiatric medicine. And today, I'm joined by three students from the Rosalind Franklin William M. Scholl College of Podiatric Medicine. All three are members of the American Podiatric Medical Students Association, otherwise known as the APMSA. I'd like to introduce each of our guests individually. Representing the class of 2025, Elizabeth Cook. Welcome, Elizabeth.
Hi, thank you so much for having us today. We're super excited to talk with you today.
Fantastic. I'm glad you're here. Also representing the class of 2025, Elena Romund.
Hi, Dr. Jensen. Thank you for having us.
Hi, thanks for making time today. Appreciate it. And representing the class of 2026, Allyson Will. Hi, Allie.
Hi, Dr. Jensen. Thanks so much for having us.
Not a problem. You know, one of our goals in doing these podcasts and talking with the students from the various schools is we're trying to give a prospective student a glimpse of what it's like to be a student at the Scholl College of Podiatric Medicine. So I thought to get started, perhaps Allie, would you please share with our listeners what podiatric medicine is?
Of course. So podiatric medicine is the medical and surgical management of the lower extremity, specifically the foot and ankle.
Excellent. There's surgical management, biomechanical management, all kinds of different areas that you can practice within the profession. So thank you so much. And then Elena, would you please share with our audience the educational pathway to becoming a podiatric physician?
Of course. So it follows a 4-4-3 model, which is really similar to MD and DO programs, where you start with 4 years in undergrad and get your bachelor's degree. And then after that, you attend one of the podiatry schools, and that is also 4 years. And then after that, you have a 3-year residency, followed by an optional 1-year fellowship if you want additional training.
Very good. Well, with that background, kind of to set the stage for the rest of the discussion, I was hoping that each of you could share your podiatric journey to date. What I was thinking is, where are you from? Where did you do your undergraduate work? How did you discover podiatric medicine? And how did you choose the Scholl College of Podiatric Medicine? Elizabeth, would you mind starting?
Yeah, I can start us off. So I'm from Joliet, which is a southwest suburb of Chicago. And I went to Augustana College, which is a really small liberal arts school on the border of Illinois and Iowa in the Quad Cities, right along the Mississippi River, which is really cool. And there I studied biology and sociology, and I played on the varsity women's lacrosse team. And I kind of got interested in podiatry when I saw a podiatrist myself. So my junior year of high school, I had a very gnarly toenail mishap at lacrosse camp. And so I went to urgent care to get it treated, and they removed my nail, and the pain kind of came back like very soon after. So my primary care physician told me to go see a podiatrist. And so I did, and became a kind of a long-standing issue. And so then flash forward to my junior year of college, I was getting what I now know is called a partial nail avulsion. And my podiatrist was asking me questions about what I wanted to do after school. And I wasn't super sure, but I just knew I wanted to go into healthcare. And she was super adamant about me looking into podiatry. And she told me all about the wide scope of practice, the variety of patients she got to see, and the work-life balance she experienced. And I was super interested in all of that. And so I looked into it, and I applied my senior year of college, and that's why I'm here now. I chose to go to Scholl because I'm from Illinois, obviously, so location was super exciting there. But I also was really, during the interview process and during the application process as well, they harped on diversity, and that was something that was super important to me, having a diversity in students in my class, as well as a diversity in patients that we see at the clinic. And when they were talking about that, I just kind of felt at home right away. And so that's kind of how I chose Scholl over the other schools. And I think that it's great, and I love being here now, so I must have chose correct. So
Well, that you did choose correct. That's great. I always find it interesting that so many of our students found podiatry through an injury, or they were treated by a podiatrist or a family member. And then that's neat that you played lacrosse for 4 years. I've always said that students that play sports, when they come into podiatric medical school, they've got good time management skills, which is always important. So thank you so much. That's great. Allie, would you mind sharing with your journey in podiatric medicine to date?
Of course. So I am from St. Charles, Illinois, which is just a northwest suburb of Chicago. I went to Loyola University Chicago for undergrad, and I also was an athlete there. I played volleyball. I played on the club volleyball team. And also, just like Lizzie, I had lots of foot issues. So I had also been to podiatrists many times. I had a lot of plantar warts. So probably from locker room, but yeah, so that was extremely painful. And it got to the point where I couldn't even walk on my foot anymore. So I had multiple treatments with a podiatrist, removing that, sprained ankles, all of that stuff. So I had definitely seen a podiatrist many times, and that led me to shadowing a podiatrist in the city. And his name was Dr. Michael Chin. He was amazing. And he ultimately was the reason why I chose to go down this route, because he specialized in sports medicine. So he had a more narrow scope of practice, but he still explained to me how wide a variety podiatry has, and how there's just so many things about it where, you're seeing derm issues, you're seeing athletic injuries, you have your diabetic foot population and that type of thing. So, and I also too, I was very interested in surgery. So the fact that it has that involved it jumped at me right away. And I loved the life balance that it has. So honestly, I was like, you can't really beat this. So I applied to podiatry school, and then in the process, I had applied to a bunch of schools, but since I'm also from Illinois, location was a big thing for me. I also liked that it was close to the city, because since I went to undergrad in the city and had a lot of my medical experiences there, I realized how important it was to be close to a city, because there's so many opportunities and there's so much more exposure that you have. So that was something that I really liked about it as well. And every interaction I had with the school was just absolutely amazing. They were reaching out to me all the time. They were just they made me feel very much at home. One of the professors, Dr. Grummett, he reaches out to you personally and makes himself very available to you. He will call you, just check in and make sure things are going okay. And so I loved how personal it was, and I felt like I just wasn't another student here. So I'm very happy that I chose Scholl, because I love it here. And I think all the rest of the faculty has similar qualities to that. So yeah.
Fantastic. I've been up to the campus for Scholl, and it's so beautiful up there too. It's really nice campus and lots of great facilities. That's fabulous. Elena, do you mind sharing your podiatric journey with us?
Yes. So I grew up in Rochester Hills, Michigan, and then I attended the University of Michigan for undergrad in Ann Arbor. And while I was in Ann Arbor, I was a part of the American Medical Women's Association and had an exec board position there. I also volunteered at Mott Children's Hospital and did a lot of volunteer work holding babies in the NICU, and spent time in some of the other units and really enjoyed that. And then I also was a part of research at the ECMO lab through the Michigan Medical School. And so all those experiences really just made me realize how passionate I was about medicine and helping other people. And so I knew that I wanted a career in healthcare, but I wasn't entirely sure yet where I wanted to go from there. So how I discovered podiatric medicine was I was actually at a medical school career fair my junior year. And I think I only had maybe 5 minutes in between classes just to stop at one of the tables. So I happened to stop at, actually, I think it was Temple, who had a table there, and they had a representative. The lady was really nice to me, and she offered to put me into contact with a podiatrist to shadow. So I took her up on that offer, and she connected me with a podiatrist in my hometown, Dr. Hussein, who I found out later was actually a residency director for one of the programs in Michigan. And he was just so enthusiastic about what he did, and genuinely, I could tell, just enjoys his job and helping others and helping out the students. And he was also involved, I think, in the regional podiatry association as well. And so I think that he really encouraged me to look further into podiatric medicine and see if that is something that I would want to pursue. And when I realized that it was a combination of dermatology, sports medicine, orthopedics, and all these other fields, pediatrics even, that I really enjoyed, I just felt like it was a good combination and really something that you don't find in every specialty. And I liked that. I also really liked that you automatically get surgical training. And through my time doing research in the ECMO lab, I was fortunate enough to be able to spend time in the OR as part of the research they were doing. And so I knew that I was interested in performing surgery as well. And so when I just looked at the big picture, I realized that podiatry could be a really good option for me. So I decided to apply, and I took a gap year between undergrad and podiatry school, and I moved to Chicago. And I really, really loved Chicago, and I had some friends and family that were close by. And so I just felt like I'd have the support system there. And so that already kind of gave me a bias towards Scholl, I would say.
Sure.
And then when I interviewed and met all the faculty, kind of like what Allie said with Dr. Grummett, just immediately all of the faculty are so welcoming and approachable and make you feel like they are just as invested in your success as you are. I knew that it would be the right place for me. And I am also happy with my choice.
That's fabulous. So a common theme, as always, is the shadowing opportunity. So many prospective podiatry students go visit all different medical specialties, and many of them come away and say the happiest profession they saw out there is podiatric medicine, probably for the very reasons you said. They can tailor their practices to what they want to do. Can you each just comment about the impact of shadowing and how much of an impact that had on your decision to go into podiatric medicine? You've kind of alluded to it already, but I just wanted to ask again. Elizabeth, did you have an opportunity to shadow?
Unfortunately, due to COVID and the pandemic, I didn't get the typical shadowing experience, but during the application process, all of the admissions teams at all of the schools were super helpful and allowed me to talk to the DPMs that worked at their schools, as well as some of their alumni, to make sure that this was the right fit for me. And all of the people that I got to talk to were super helpful and answered all of my questions. So I didn't get to typically shadow, but I did get that experience.
Okay, very, very good. And then Allie, you said it was had a tremendous impact on you.
Yeah. So I shadowed Dr. Chin, and he is in the city. And coming from an athletic background, seeing how he worked, he is a podiatrist for the Chicago Marathon and a lot of things like that. So he's very much involved, and his patient population is definitely really intense athletes. And I thought that was really cool because, I was new to podiatry. I didn't really know too much about it, so I didn't have any expectations at all. And so he just completely opened my eyes to so many things about it, but particularly sports medicine. And that is, I'm not sure what types of things I might want to specialize in, but it's definitely an option just because that hits close to home for me. And yeah, it was the ultimate deciding factor that I really wanted to go into podiatry, because he also too is just the way that he takes care of his patients. I don't know. I just want to be like him. He's just amazing. And he's so knowledgeable. And his patients really respect him. And so I thought that was amazing.
Fantastic. And Elena, with Dr. Hussein, same kind of experience?
Yeah, definitely the same experience. I remember one time I shadowed Dr. Hussein, and he was telling me, if you go to podiatry school, you will have to practice numbing each other's toes, and you start with each other.
Right.
And I was so scared, and that almost made me second guess it, because I do not like needles at all. And so I was like, I don't believe you. I hope not. And then I came back and shadowed him while I was studying for boards earlier this year at the beginning of summer. And I came back to him and I said, yep, we did it. You weren't kidding. And so he just, like, his pearls of wisdom and just advice always ended up being spot on, and he was helpful. And then I also shadowed a couple of podiatrists at University of Michigan as well. I think Domino Farms is what it's called. And they were able to show me a lot of pictures of pre-op, post-op, bunion procedures, things like that, which I didn't get as much of in Rochester. And so I saw different things at both, but both were equally valuable.
Well, that's great. Just a quick story about injecting each other. That's been going on for decades. And I remember when I had to do it with my friends, and my friend had 5 cc's of lidocaine loaded up, and he put it all into my big toe, but my big toe didn't change in size. He had put it through the toe and it was going on the floor. So just kind of a funny story. I thought that didn't hurt at all, really hardly. So never changes, of course. Fantastic stories. I'm glad you all had a great shadowing experience. So the next thing I'd like to talk about is your involvement with APMSA. And that's just a tremendous leadership role. And really it's icing on the cake, because you're there to get an education. But what a wonderful opportunity to learn about the profession and be a leader, not only within your school, but within the nation in podiatric medicine. Do you mind each just commenting on how you got involved with APMSA and what your current roles are? Elizabeth, would you mind going first?
Yeah, I can start us off. So I became really interested in APMSA during our school's activities fair during my first year. I've always been drawn to organizations that are student-led and that students can represent themselves. And I served in a lot of similar roles during undergrad, and I was excited when I heard about APMSA, just to kind of throw my hat in the ring because it was an elected position. And so when I was talking with the 4th year delegate now, Henry, about all of the different things that APMSA did and all of the different committees, I was super excited to kind of help grow the committees, but also be a part of something bigger than just myself and just my school. And so I was super excited to do that. And then when I got the position, I was excited to kind of represent my class and podiatric medical students as a whole. And then when I got to choose my committee, I was back and forth between legislation and education, and I ended up choosing education, and I'm currently the education chair of the committee. And it's a super exciting experience. I've gotten to meet so many people from different schools, as well as so many doctors. And I'm just very excited to continue to grow the education community, because the main goal is to educate students, to bridge the gap between practicing podiatrists as well as and students. And so that was kind of the main things that I was excited to do. And now I'm doing them. So everything is great.
Fantastic. Allie, how did you get involved and what are your current responsibilities?
So I found out about APMSA through an IPMA board information session that was hosted at Scholl. So they talked, of course, mostly about the Illinois Podiatric Medical Association, but they also talked about APMA and then the student associations as well. So IPMSA and APMSA. And I just felt very moved by everything that they were saying. And just the power that they have, they're going up to Congress people's doorstep and, directly speaking with people to try and help our rights and, make sure that podiatrists have their, keep their practice and what we're able to do. So I knew right away that after that session, I wanted to go to the national level instead of just on the state level, since, they were from IPMA. But I thought that was so cool that students from each school could go to these conferences or the House of Delegates meetings, which is what we call them. But we could go to these meetings and directly vote on things that affect our education. And, it wasn't just all talk, it's actual action. So I think that's really cool. So that is how I got involved. I am also on the education committee. I don't hold a specific leadership role within the committee. I am just a member of it. But I also think I was between education and the legislative committee, just because those two had the most impact to me personally, just in my interests. And I went with education. And it has been so cool so far because we've been working on the clerkship survey, which is like one of the big things that we do. And it's just a survey that's sent out to third and fourth years where they get to put down all their input about the clerkships that they went on. And just, even just looking over this document to edit it and stuff, like I'm learning about these programs and stuff like this. And the fact that we have a resource like this that's available is amazing. And it's so helpful. And I know I'll definitely be using it when I'm next year making my decisions. But I just think it is so amazing because, like I said, when you go to these meetings, it is not just all talk. There's a lot of action happening, and you're talking directly with people who are heads of massive companies like NBPME, who put on our boards and stuff. So the fact that we can talk with them and express our concerns to them and what the student experience is like, and then for them too to give us feedback on what's going on their end. I think it's very important to learn about those things and be educated on that going through our education.
That's great. No, such important committees, and the exposure you get with people throughout the profession is amazing. On one hand, it makes you appreciate how much goes on, but it also makes you appreciate how small the profession can be too. So that's great. Elena, how did you get involved with APMSA, and what are your current responsibilities?
So I am president of the Illinois Podiatric Medical Students Association, and one of my responsibilities is attending the APMSA conferences with the other delegates. It's definitely one of my favorite parts of having the role, just because it's one of the few opportunities students get to come together with students from all of the podiatry schools and exchange ideas. And I love meeting with other students and talking to them and talking to students that are in some of the classes above us as well. And they can share how clerkships are going, things like that. But so that's how I became involved in APMSA. So the presidents actually serve for 2 years instead of 4 years like the other APMSA delegates. So your first year's as president-elect and next year's as president. So we are all a part of the APMSA President's Committee. So the two main things that we do on that committee are we come together and help nominate the APMSA Student of the Year, who then receives a scholarship at our July APMSA conference. So each school nominates one incoming fourth-year student to be the nominee for their school. And then the President's Committee comes together and they determine which student out of all the podiatry schools receives its award. And then the other thing that we do is we help plan and organize the academic and athletic conference, which they didn't have for the past few years due to COVID, but we are planning on bringing that back next winter or this upcoming winter, which is really exciting. So traditionally, there was a academic component where we had different speakers come in, and then the athletic component was a inter-school basketball tournament. So I'm not sure if they'll be doing the basketball tournament again, but I know that they will have some sort of fun athletic component. I'm not sure what yet, but I'm excited to see what we come up with. So those are the two main things that we do on that committee.
Fantastic. Yeah, I heard that they may expand the athletic competitions beyond basketball. So that's good. Very good. All right. So let's talk about the educational experience at the Scholl College. I was hoping one of you could each take a year. And Allie, since you were most recently finished your first year, do you mind talking about the first year at the Scholl College? What kind of courses are you taking and how's it structured and the exams? The floor is yours.
So first year it's an adjustment. It is definitely an adjustment, but every step of the way, I enjoyed it the entire time. You start off with a lot of basic sciences, so biochemistry and genetics, like structure and function, which is basically your histology and physiology of the body, clinical anatomy, microbiome and immuno. So a lot of kind of foundational sciences to give a good background. And then as you more so get into the spring, we started taking lower extremity anatomy, as well as a course that we have called PodMed. And they've restructured it now a little bit, but when I took it, you have introductory lectures on major topics. So like one of the lectures was on the diabetic foot, and another lecture was on labs and when, all the different types of labs that you can order, when to order them, things like that. Surgery was another lecture. So just a lot of foundational parts of podiatry and having a lecture on them. And then what else do we take? I'm blanking, but we had more so in the spring, we started getting more into the lower extremity and starting to focus on that as opposed to just generalized medicine of the body, which was mainly in the fall and winter. So that was that. Our schedule was pretty crazy. We had, I don't think there really was a week that we didn't have an exam. So we had at least one exam a week. We have some quizzes here and there, but honestly, going back to how amazing the faculty is, I truly don't think that I would have been able to do it without them, because they know exactly what you're going through. And because they make themselves so available and they develop a personal relationship with you, you can talk to them about anything and they're always checking in on you, but also too incredibly encouraging. So kind of like Elena, you had mentioned, they are are really supportive of you. So that was super helpful to me, because I knew I enjoyed going to class because I know they're going to be great and they're going to be encouraging. In class, they made fun a lot of times. So Dr. Grummett would make cahoots for us. So that was fun, to have some practice questions and stuff like that. But yeah, I mean, that was about it. Yeah.
All right. Thank you so much. Elizabeth, do you mind sharing the second year experience at the Scholl College of Podiatric Medicine?
Yeah, I can talk about the second year. So in between the summer, in between your first year and your second year, you take biomechanics and you start your clinical experience by shadowing a P3 in the clinic. And then as you start your P2 year, you start in a couple classes. So you start in sports medicine, dermatology, pharmacology, and I think pathology. Sorry, that was a long time ago. It feels like forever, I think. And so you start with a couple of classes and then you finish dermatology and you finish sports med. And then you start classes like our class on surgery and our class on medicine, which is more based in internal medicine, and then radiology. And you kind of continue those classes through the end of the year. You start clinic at the beginning of the year. You have clinic not as often, but then once you hit January and the P3s are off on clerkships, you start clinic by yourself. And I think that was a great opportunity because you had time to work with P3s in the clinic and kind of see how they do it. And you had opportunities to work with several different P3s. And so you kind of could see exactly what some students do that you liked, what other students did that you didn't necessarily like, or you didn't know how to do, and you had the opportunity to ask. And I thought that was a super helpful experience, especially then starting in January, starting clinic by yourself, where you go in, you introduce yourself, you take the history, and you do the physical of the patient, and then you present to the attending. And I think that was a super important experience because you have to see how to present before actually having to do it yourself. And that was very nerve-wracking for me. So having seen a couple different P3s do it and then modeling my presentation off of them, it was definitely helpful. And then you can, after January, you kind of continue with your classes. And we also have a class called PCSR, which is where you're learning all of the different skills. Like Elena was talking about earlier, that's where you inject each other in the foot. You learn how to do that, which also was a very terrifying experience for myself. So I'm also afraid of needles. So you learn all of those skills there. And that is super important too. Overall, I think that in comparison to first year, second year is more clinical based, and the questions on your exams are more clinical vignettes and how do you use the information that you learned first year and that you're learning in your classes to help form your clinical knowledge and how you're going to treat your patients in the future. And I think that was one of the main reasons why I liked second year a lot, because it was more applicable to what I could see myself doing later than first year. And so I like second year a lot.
Fantastic.
So
I have a question for you. A lot of students always ask this. What does the Scholl College do to assist you for boards prep? Do they give you some time off? Do they do boards reviews? How does that work? And Elena, you can jump in on this too. But go ahead.
So we get a month off of school in order to study for boards. And during right before that, we take a practice boards exam that was made by our school. And if you get above a certain score, then you don't have to go to the boards review sessions that are during that month that we have off. But if you score below, then you're required to go. And I went to all of those sessions and they were super helpful. There was sessions on clinical anatomy, lower extremity anatomy, pharmacology, pathology. And so the clinical faculty came in and kind of talked about what the questions could look like, what are the main high yield questions, high yield topics. And it gave us an opportunity to kind of ask questions right then and there and kind of form the path to studying for boards, because there's a lot of information that you have to know and you have to remember. And so by having somebody guide you through that process, it was super helpful. I don't know if Elena has anything she wants to add to that. But.
Yeah, so just a couple other things to add on to that. The school also gave us access this year to osmosis, which is really helpful. There's videos that explain some high yield topics, kind of similar to like Sketchy Path or Sketchy Farm. And so I think it's really good for visual learners or people that prefer to do that rather than looking at just words on a page. And then they also survey the students that have already taken boards and ask them, looking back, what resources were the most useful for you? What things would you have done differently? What did your study schedule look like? I don't know if I already said this, what resources were the most helpful. And so then they provide that to all of us before we really need to start studying, just so that we can see what other students have said who already went through it. And I looked through that and I tried to follow a lot of what other students said. And I'm glad that I did, because you definitely have to start studying before you think you need to. And you can't just look at board vitals and that's it. You have to do more than that. So
it's kind of like the first high stakes exam we have, first big hurdle in the profession. So that's great. So Elaine, if you wouldn't mind continuing on, what's the third year look like at the Scholl College leading into clerkships in your fourth year?
So third year, and I'm sure Lizzie would agree with me on this, is a lot different than your first and second years. So at Scholl, they divided up into 4 capstones. So you have your surgery capstone, orthopedics capstone, radiology capstone, and medicine capstone. And each one is 6 weeks long. And it's really, the way I like to think of it is it's like each one's a boot camp getting you ready for clerkships. So you're broken up into smaller groups within your class. Whereas before we had class with everyone, and now you really only see your capstone group for those 6 weeks each time. And so it's a lot more one-on-one time or small group time with different faculty members going over those different subjects. And your evaluations are a lot more skills-based and project-based rather than just solely multiple choice exams. So that's how they do that. And then within each capstone, we also have dedicated time each week to being in clinic as well. So some of the time we will spend, I think during surgery capstone, you are at the RFU clinic. And then during the other 3 capstones, you can get sent to a lot of different hospitals in the Chicago area, including the Jesse Brown VA hospital. You could be at Loyola Hines. You could be at, I'm not sure what the other ones are that you could go to if Lizzie wants to jump in and share those. But it's a great opportunity to see some of the other hospitals and how they operate. And also, I'm going to be at Jesse Brown VA for the next capstone. And I know that that's where some of the 4th years out on clerkship do their core rotation. So I think that I'm really looking forward to seeing some of the 4th years and seeing the improvements that they've made in their abilities to help patients and their hand skills and just talk to them about how clerkships are going again. So third year is definitely different. And they also spend a lot of time helping us prepare for our clerkship applications as well. We each get assigned a faculty mentor who will review our CV and give us some feedback. And then we also have our OSCEs, which is where we have standardized patients and a simulated case, and we are evaluated on our abilities to do a full H&P and physical exam and provide a diagnosis and treatment plan for a patient. So that's something that we will be doing in October as well.
Fantastic. And then the fourth year, you're doing clerkships up until January, typically, where we have residency interviews and, of course, sports part 2 waiting for you in fourth year.
Yeah, I totally left out the fact that starting in January we'll be in clerkships, but yes.
Nope.
I can add on to that if you want me to.
Sure, feel free.
Yeah, so then in January, we start our clerkships, which are a month long. You apply for some of them. Some of them are electives, and those are the ones that you apply to, and those can be anywhere across the country that you may be interested in going to residency for 3 years. And then we also have some that are our core clerkships, and those will primarily be in the Chicago area. We also have a few, I believe, internal medicine, general surgery, and ER, and those are typically in the Chicago area and are each a month long, but you have the opportunity to do those in a different state where that is offered as well.
Very good. So my favorite part of doing these is the next section where we do professor shout outs. I'd like to give each of you an opportunity to give a shout out to a professor that's really made a difference in your educational experience. Allie, would you like to go first?
Yeah, so I have already mentioned him a bunch, but Dr. Grummett, he is absolutely fantastic, and he's so encouraging, and he just knows, he gets to know you well enough that he knows how to encourage you. And he's just your biggest cheerleader. He makes himself available whenever you need him. And he teaches a lot of the first year classes. We don't really have him anymore after first year, but I saw him all the time during first year. And so he's such a great teacher, and he's very passionate about taking feedback and really like bettering his classes each year. So that I really like about Dr. Grummett.
Fantastic. Elizabeth.
I think I want to shout out Dr. Jaffe. I just finished my medicine capstone, and he was in charge of it. And he's super helpful throughout the whole entire capstone. And he also teaches the Durham class. And just learning from him, he has so much knowledge, and he really wants us to know like so much, and he holds us all to a high standard. And I think that that's super important. And he also, I had the opportunity to work with him in the wound clinic, and all of the patients, every single one of the ones that I got to see with him just couldn't stop saying all these great things about him, and about how you could just tell he cares a lot about his students, about his patients. He also, big shout out for his Instagram. He puts board review questions on his Instagram story, and he does like a little explanation after, and that was super helpful during boards. And right now, some of them were based on the class that we were just in. And so it was definitely helpful to kind of see what questions he thought were important and high yield, and then also hear the explanations. He definitely makes sure to do those, especially when a lot of people don't choose the right answer. And so that's super important too. So he's just so awesome, and he's in charge of a lot of different things, wears a lot of different hats. So I just wanted to shout out Dr. Jaffe for that.
That's great. Thank you. Elena, Professor shout out.
Wow, you guys took some good ones. I am going to shout out Dr. Schnack because she is one of the new faculty members that we had join us, I think, last year. And she is she's so great and probably one of the most approachable faculty members that we have. She loves to help out with different club events all the time. And I've also been fortunate enough to be with her in clinic a couple times. And she has some really complicated patients, a lot of follow-ups for amputations, or I think she had one patient that had bilateral calcaneal fractures. And so she just does a great job of sitting down with you and taking the time to explain how she would care for the patient from beginning to end. And I love being able to go into her office and follow up and see how her patients are doing that she's caring for. And so, again, I think she's a younger faculty member, and so she can really relate to being in our shoes and empathizes with us, but also pushes us to be the best that we can be. And so I really enjoy working with her.
Oh, that's great. All right. I have a series of questions that I'm going to ask you, and I'm just going to ask you for one thing on each. What is the one thing you would tell new students to help them be successful academically at Scholl? Elizabeth.
I think the most important thing is to notice when you need a break. School can be a lot sometimes. And I think that something that I struggled a lot with when I was a first year was recognizing that I couldn't keep going the way that I was going. And to realize that it's okay to step back and it's okay to take time for yourself, because we all are humans first before we are students. And so that would be my biggest advice, is to not, if you feel like you can't if you can't look at school anymore, you can't do another Anki card, you can't do another Quizlet, or just take a second, take a deep breath, give yourself a little bit more of a break, and then try again in a little bit.
Words of wisdom. I like that. Allie.
So my best advice is do not compare yourself to others. That one was a really tough one for me first year, because when you're trying to figure out the best way to study, and how you work best, and, they tell you to group study because that's super helpful, which it is. People are just doing so many different things. And since everybody's in the same boat of trying to figure out how to study and what to do, it's really easy to compare yourself to others. And if you feel like one thing might be working with you, but somebody else isn't doing it, like, stick to it. Doesn't matter what other people are doing. If you're seeing good grades come out of it, then you're obviously doing something right. So for me personally, like, I started off with a lot of group studying, but I do less of it now, which actually is super beneficial for me. So I only group study when I am able to, when I'm very comfortable with the material, like the day before an exam. So do what you need to do and don't be afraid to take control over that.
Great advice. Thank you. Elena, what nugget would you give to a student to ensure success?
I would say, remember that the people that you're in school with are going to be your future colleagues. So it is to your benefit to work together, help each other out, share different resources. If you want to study together, study together. I found it really helpful reaching out to students in the class above me, and they were more than happy to share study guides or flashcards that they had used from uh, the classes that I was currently going through that they had already been through. So I think it's just realizing that, everyone wants to help you out. And for the most part, I would say Scholl really does have that environment where everyone's helping each other. And then you can pay it forward and do the same thing for the people in the class below you. And it just, I think, makes your experience so much better and keeps it a happy place to come to every day.
Well, that's great. Well, you kind of stole a little bit of what I was going to ask in the next question. What would you tell a student who's thinking about going into podiatric medicine about the Scholl College of Podiatric Medicine? Elizabeth.
I think kind of like what Elena was saying and Allie hinted at earlier, the faculty here are so helpful and they only want us to succeed. Our success is their success, as one of our faculty members always says. And so it's just super important to find a place where you feel comfortable and you feel like you can relate and talk to the faculty right away. And I think Scholl is one of those places where right away, like Allie was talking about Dr. Grummett, like you kind of get this feel that the people here want you to succeed and they want you to be, they want you to go where you're supposed to go and they want you to feel comfortable. And I think that that's the biggest thing that I love about Scholl is they want me to succeed, not just because I'm their student, but because I'm me, And so I think that that's what I love about Scholl.
Your future colleague, for sure. That's great. Allie, what would you tell a prospective student about the Scholl College of Podiatric Medicine?
Definitely everything that Lizzie said. I second that. The faculty is amazing. One thing I really like about Scholl particularly is the fact that they really take feedback seriously. So we do surveys for every class after we finish them. And then we do an overall survey too at the end of, I've only finished first year so far, but we did a survey after first year, just kind of recapping how everything went. And they make it a point to really take everyone's feedback into consideration. Classes change every single year and schedules change every single year because they are constantly taking that feedback and trying to make it better and better. And so I think that is really amazing because not only do you have great faculty who are there to support you and who really care about you as a person, but they also too are trying to make everything better for your education. So they're in your corner as far as like wanting you to succeed in the best way possible, and then furthering that down for other classes too. So I think that is an amazing thing about Scholl.
Well, that's great. Elena, what would you tell a student about the Scholl College of Podiatric Medicine?
Allie took mine. I would say there's so many resources that they provide you with to be successful. You just have to, advocate for yourself and your education, but all the resources are there. I mean, they offer free tutoring if you need it. They have the Big Little Mentor program. So you come in your first year and they pair you with a second year student that kind of helps you along the way. So you automatically have a buddy and a support system within the school. We have faculty mentors as well. So, I mean, there's so many other things that they have too. We have a class drive where students can share their study guides, different things like that. So they make sure that you have all the tools that you'll need to succeed. It's just a matter of going and making use of them. So it should never be a concern, even though they say that medical school is like drinking out of a fire hose, and they say the same thing about podiatry school. It's doable, and they really put in the time to set you up for success.
Well said. That's great. Well, I will tell you that with students like the three of you, I know that the future of podiatric medicine is in good hands. I commend all three of you for not only taking on the podiatric medical education, but being leaders at the school level and at the national level with APMSA. So congratulations. I'm sure I speak for your faculty that we're all looking forward to following your careers. That's wonderful. But we're running out of time. So I wanted to thank you again for being here. And I wanted to let each of you know I'm going to send you a Dean's Chat cup because I know you're going to have a lot of late nights and early mornings. And to all of our listeners out there, if you're listening on Spotify or Apple Podcast or Google Podcast, please give us a 5-star rating. And if you're watching on YouTube, by all means, please become a subscriber. So until next time, thank you so much and cheers.